We're talking all things Medicare right now with Catherine CVA with AARP of North Carolina, Steve Edmonds with Alliance Insurance Services. Steve, this person says, when you say there is no premium for Advantage plans, we are still paying the Medicare premium, correct?
That is correct. When you turn 65 and go on Medicare A and B, Part A is free, no charge for Part A. Part B, there is a premium. I think it's like 164.90 per month this year, and we talked about a while ago. It's going up next year a little bit, but yeah, everybody pays that. You're going to pay your Part B premium. So the zero premium that I'm talking about is the insurance premium, not the Medicare premium. So you do owe the Medicare premium, yes.
Okay. All right, Catherine, this person says, if you retire before you're able to get Medicare, can you use your HSA to pay for insurance premiums until you're able to get Medicare?
Absolutely. That's really one of the main things that HSAs provide for, but you can't use an HSA once you're on Medicare.
Okay, you cannot use an HSA once you're on Medicare.
You can't use your HSA to do something like pay for your Medicare premiums.
Aha, okay, gotcha. All right, so this person says, what is Medigap? It's my understanding that it's hard to change from Medicare Advantage to Medigap. Can you expound on that, Steve?
Sure thing. Okay, so Medigap is going to be the exact same thing that I was calling a Medicare supplement in our first segment. So when you hear the term Medigap and a Medicare supplement, exactly the same coverage. It's just some people call it one thing, some people call it another. It can be very hard to change from Medicare Advantage to a supplement or a Medigap policy once you're past age 65, because you would have to go through medical underwriting. If you're healthy, probably no issues. You can change anytime if you're healthy. If you're not healthy, they're probably not going to accept you for a Medicare supplement. So you would have to stay with a Medicare Advantage at that point.
So it sounds to me, I know that there's pros and cons to both, but I think to myself, do more people go with a Medicare Advantage because it's easier and then you can switch if you need to versus the other way around?
I think people go with Medicare Advantage. There's two reasons. Number one, you can get a really good coverage for zero premium. That's one of the big things. The second big thing is all these other benefits: the dental, the vision, the hearing, the over-the-counter drug coverage. And then even with a lot of these Medicare Advantage plans, I'm just hitting the surface. There's other perks that you get with these. And so there's just a lot of added on benefits. And I think that drives people toward Medicare Advantage coverage.
Gotcha. All right, Catherine, this person says, I have a Medicare Advantage plan and I'm retired military. I also have TRICARE for life. Do I need to look into other plans?
No, not at all. Your Medicare, I don't know what your TRICARE for life is paying if you're on a Medicare Advantage plan at this point. But there probably are a few things that they pay for that might not be covered in your Medicare Advantage, but generally Medicare Advantage does not bill TRICARE for because it's a comprehensive plan.
Okay. This person says, I've been on my wife's insurance for several years and I am 80 years old. Due to divorce, I must now get Medicare insurance. How do I do this? Steve?
So you would do it just like anybody else. I mean, you're going to start by calling Social Security, and you're going to tell them that you need to sign up for Medicare coverage. Now, there's a lot of unanswered things here. We don't know, have you been on Medicare in the past, or have you been under your wife's group insurance in the past? We don't know those things, but if you need Medicare, you need to start by contacting Social Security, and they'll guide you through that process then. But you need to get your Part A and your Part B activated, of course.
Catherine, this person says, if you're already signed up for Medicare, do you have to renew it each year along like United Healthcare? I guess that's their plan that they have, but do you need to renew it?
No, you don't have to do anything once you're signed up. And my TRICARE expert here just told me that to the other question about Medicare Advantage, that TRICARE pays in the third position if the person has Medicare Advantage. So if there was something Medicare Advantage might not pay, then they might be able to pay if that was part of their coverage there.
Okay, gotcha. So this person's asking, I'm not retiring or going on Medicare when I turn 65, and I plan to stay on my employer plan. Do I still need to register with Social Security? Steve.
Yeah. What you're going to do is you're going to let Social Security know. What you're basically going to tell them, I want my Part A. Part A is free. So, and you just need to go ahead and activate Part A and get it going. And then you will tell them, I want to defer Part B because I'm going to have group insurance through my employer. So you defer Part A, but you take Part B. Now, one word of caution. If your employer is a small employer, meaning less than 20 people, then that group insurance might not be credible coverage. So you want to always check with your employer and with their HR department and make sure that the group insurance is considered credible coverage by Medicare.
Yeah, I think too many people are under the impression that, you know what, I'm working, so I don't need Medicare, but you have to sign up. Otherwise, there will be penalties for the rest of your life. So sign up, sign up, sign up, sign up. I don't know how else to say that, right, guys?
Right.
For sure. All right. Thank you both for your time and your expertise. I'm sure we will do this again as well. If you have any questions, you missed anything, what we want you to do is go to the 2 Wants to Know section. We're going to put all of this in there for you.